5 seconds. Sir, I rise to support the Juvenile Justice, Care and Protection of Children Amendment Bill 2011 with the hope that this will take care of the mentally ill juveniles of our country. While supporting this bill, I have a few observations to make. The mental hospitals and nursing homes in our country are not in adequate number, and particularly those hospitals in the public sector are in a very wretched condition. I cannot, being a doctor, also tell this house with much emphasis that sending our mentally ill juveniles to those places will help to get rid of their problems. Rather, they will be plunged into further problems. So, before sending them to those hospitals, the health of these hospitals should be taken care of first. My second point is that due to the present socio-political economic milieu, mental illnesses are increasing all over the world. It is also engulfing the tender brain of our children. As a result of social unrest, uncertainty of livelihood, and deterioration of social and moral values, including familial disharmony, children are falling victims of mental diseases. The present amendment has promises to deal with mentally ill children, but can we find any bill which can prevent the development and spread of such illnesses? We must ponder over the present socio-economic system which is producing such maladies. Mental illness still remains a stigma in our society. The affected persons are not treated well. It should be preached strongly by the government and all other agencies that medical science has remedies for this with medicines and proper care. As mentioned by Honorable Member, mental patients are kept in jails due to provisions in the Mental Health Act 1987. This is an old act and requires complete revision. I also request this House and the Minister to take care of that. I will appeal that no such mentally ill patient, including the juvenile, should ever be sent to jails according to the provisions of this act. In West Bengal, there is a very old and famous hospital, Mankundu Mental Hospital at Hooghly district. If properly taken care of by the central and the state governments for its revival, lots of juvenile mentally ill patients and mentally challenged adult patients will get benefit of this hospital. So, it should be taken care of properly. Drugs for mental illness are very costly nowadays. The government should ensure that these drugs should be made cheaper and should be regularly supplied to the homes and hospitals. Many of previous speakers have mentioned that the condition of the hospitals, particularly of the homes and shelters, is very bad. Violation of child rights, malnutrition and maltreatment are going on there. Many a time, not only the male inhabitants but the female wards also try to flee from these homes due to very unfriendly and unsocial practices within the homes. That should be sincerely prevented. I would like to add two very new points which are not mentioned in the house. In these homes also, the narcotic drugs and substances including alcohols are being supplied with the help of guards and the administration. They should not be supplied with these things and they should be kept away from such substances. That should be taken very seriously by the government and by the administration. At last, many of these patients, including the juveniles, after recovery, are not taken away by their relatives and parents due to the social stigma, due to their social segregations and economic backwardness. How can these problems be solved? Being a doctor, I have faced it in the hospitals. That should be taken care by the government through this bill. Sir, children, as we all are aware, constitute 40% of the population of our country. Over this period, perhaps on many matters on which the children need care and attention, our society has not been sensitized towards them. All the concerned persons, whether they be the guardians, the individuals, or the concerned departments, have perhaps not in the past shown that concern, shown that feeling of empathy for the children. Coupled with the fact there has not been adequate data available to these agencies, that led to a situation where we have not been able to do what we intended to do for the children and what we must do for the children, the most vulnerable sections of our society. Sir, the required policy and legislative framework being in place, particularly when we have markedly moved with a paradigm shift in governance from a welfare-based approach to a right-based one, and in this case, before I advert to what has been done, because that was a question which was raised by this government, I would briefly like to refer, though there should not be any need, to some of the legal provisions in the Act.